So what's your name?
My name is Robbie Mezer.
And Robbie, where are you from and what do you do for a living?
I'm from Westminster, Orange County, California. I'm an occupational therapist.
And how long have you been practicing?
About 3 years now.
Okay, awesome. So you heard about Dr. Jacobs online, or how did you come across ASTR?
I actually connected with Dr. Jacobs first on LinkedIn.
Okay.
And after that, got a link to go to YouTube and watch some of his videos.
Mm-hmm.
I was very impressed, to say the least. And I felt that there's a lot of more knowledge for me to acquire and that this class will be value added to my career, so I decided to attend.
So was it mostly just for the educational benefits, or like what really pushed you, to sign up for the class? You wanted to get better outcomes with your patients?
One thing that stands out for me is pain. My patients always tell me if we can get rid of pain, then that will be the best gift I've ever given them.
Okay.
And a lot of times I'm successful, but I have cases where I wasn't able to actually help my patients decrease their pain level.
Okay.
So when I saw the videos and I saw how the patients acted when Dr. Jacobs worked on them, I said, okay, this is exactly what I'm looking for, but I have to acquire those skills.
Okay, cool. So you've been with Dr. Jacobs now for 4 days. You guys are getting ready to graduate. What are your thoughts about the actual class itself, the material, and also Dr. Jacobs? He's the one teaching it. What are your thoughts on his presentation, his knowledge base?
Dr. Jacobs for the last 4 days has given me so many things, different aspects of knowledge, not just one aspect of knowledge. And what I mean by that, the class itself has been kind of like a big basket that encompasses all the tools and the knowledge that I need to be successful with my patients. Incorporating the biopsychosocial model into the treatments, the holistic approach, the hands-on, the labs that we've done had brought a new perspective for me that I've been kind of like missing for a while. I studied a lot of holistic stuff and approaches in school, but I yet to practice it. And today, and through the last 4 days, I learned firsthand how important it is to get back to the original thoughts of being holistic, and focus and emphasize on nutrition, and getting to practice the maneuver that Dr. Jacobs has taught us, which is very unique and it does not exist anywhere outside of here. Plus the tools that he had invented himself after trying them for so many times, and they have proven very effective because they actually have treated me in the last few days. And I was just telling him right now how good and I felt and how much energy I've gotten out of these treatments.
What has he treated you for?
I have a lower back injury. I've had a surgery in my lower back. I've had tightness. I have a lot of pain that radiates down on my left leg. Pain goes in and out. It never leaves me completely, so I'm kind of like stuck in between. I have bad days and good days. Mm-hmm. And just in the last 4 days, doing treatments on my back, my abs, my calves, my legs, I feel so much looser. My muscles feel so much more flexible. I have more elasticity. I can move better, and my pain is minimal.
What do you think, because you understand ASTR, so what do you think specifically that he did gave those types of results? Like if you could focus on a few of the approaches that he used, was it the scar tissue, like the fascia restriction? What helped you the most?
Showing me the connection between the fascia, the scar tissue, and the way to release them was key for me that I take home with me. When he started working on the superficial layers of fascia and he released those, I felt a little bit of relief. Mm-hmm. And then he showed me how when you go deeper to different layers of muscles and use different maneuvers and ASTR tools, you can actually even release more scar tissue underneath that fascia, and then you kind of get a double positive outcome from that.
Okay, and what about the first day when we were covering like the trigger points and stuff like that? Have you had a chance to experience that yourself? I
have. I actually got treated, and I treated a colleague of mine in the class as well.
Okay.
And we discussed the results of that. And I have a triceps issue. I pulled this muscle 3 months ago, I've taken medication. I've done my regular stretches that I do. It improved, but it got to the point where I hit a plateau, and I just couldn't get rid of the last maybe 2 out of 10 pain that I have, and I also lost a little bit of flexibility in my elbow. So the concept of GTO and
can you say what that is for someone that doesn't know?
The Golgi Body Tendon, which is attached to the end of the tendon of the muscles, and it's a receptor, and when you actually activate that receptor, you have better connection with the muscles and you gain more elasticity and flexibility with the muscles. So they focused on my triceps and my biceps. We did agonist and antagonist muscles, and that helped me actually gain my range of motion 100% again.
How do you, so you're 100% right now?
100%.
Awesome, that's great. And how long has it been since you felt that way?
The last 3 months I didn't have full range of motion.
And how many treatments?
I've done therapy on it every single day.
No, I mean like for ASTR. How many ASTR
It was
treatments?
the first day of ASTR.
For the first time. That's awesome.
Yeah.
Okay, cool. So you've had a lot of personal experience with ASTR treatment during this trip.
I did.
Great. Okay. So how confident do you feel like going out the door right now, working on other patients of yours? Do you feel like you know what you need to do?
I've been exposed to a lot of hands-on during the last 4 days. I have practiced on many colleagues, and we have practiced on multiple diagnoses, and we have practiced from head to toe. And that's a really good thing about ASTR is in 4 days, we didn't just focus on one area. The whole body is connected, and spiritually and physically, and we really were able to practice from head to toe. And
Great.
that gives me a lot of exposure, so I feel confident going out and start treatment on my own patients.
Awesome. And if there's anything else you'd like to say, like to other colleagues, you know, you graduated not that long ago, and there are other people that are finishing school that may want to do, take a different approach to treatment if they're PTs or OTs or chiropractors. What would you say to convince them to sign up for ASTR or to learn more about what Dr. Jacobs is doing?
ASTR is a very unique concept and a discipline by itself. I can tell them you will never learn this anywhere else. I went through school, I've been practicing for a while, and I haven't seen or practiced anything as unique as ASTR. So you can't say I graduated and I got all the knowledge that I need. You have to come in, you have to try it because it does work, and I highly recommend it.
Awesome. Thank you so much.
You're welcome. Thank you.